Hi, this is Will of Macclesfield Chiropractic. Today we're going to talk about being able to engage the muscles between our shoulder blades. Now, the muscles here are what we call scapular stabilisers, and they help to keep the shoulders back and down. Unfortunately, most of today's society and posture really does make our shoulders elevate and become a little bit rounded. And from the side, you start to become elevated and rounded, and the head and the neck position starts to become forwards of our chest, and that sort of pressure starts to build and cause tension, stiffness, problems, symptoms, headaches, etc. So we're going to talk about how to counteract these effects by strengthening and mobilizing our middle back so our spine can remain more neutral and our shoulders and shoulder blades can remain more backwards and down in a more neutral position. And basically we have to start to learn how to thoroughly engage these muscles and actually learn that mind-muscle connection that some people speak of. And it's not something that actually comes particularly easy, sadly. So there's a few tips and hints which can help to engage those muscles more efficiently. I'm just going to turn around so you can actually see what I'm trying to do. First off, we're going to just gently straighten our middle back, and we can do that by just pretending to lift our chest slightly, and you'll notice that we don't want our head to tilt into extension now, so we just have to counteract that. So in this position, straighten middle back, we can have our arms by our sides, and we're going to just slowly start to externally outwards rotate our arms, and at the same time what I'm trying to do is engage and squeeze these middle back shoulder blade muscles. We're going to find that position. Now if you find your head tilting back, again just correct that. And we're going to hold a little squeeze and a contraction for the count of 5 to 10 seconds to begin with. And we're going to relax, and we're going to repeat the process. So we're just going to straighten up the middle back by lifting the chest. If our head's tilting back, we're just going to correct that. Arms by our sides, we're going to start to externally outwards rotate our arms, just contracting the middle back. And again, I'm just trying to hold a contraction there for about 5 to 10 seconds. A few things to definitely try and avoid is one, is our head tilting back, correct that, and two, if we actually start to elevate our shoulders while we're externally rotating our arms, that's incorrect because we're trying to deload here, we're trying to encourage contraction of these muscles here, so it's not going up and back, it's going perfectly back. The tip is to be able to feel these muscles working, not here. If you're working here, if you feel these are working here, the chances are you're elevating, you're not quite doing it correctly. So lift the back, lift the chest, externally rotate and squeeze, and hold that for a count of 5 to 10. Don't do it so hard that you actually cause a pulled muscle, but we want to definitely feel the muscles work. The common things, you'll feel it stretch and open up the collarbones and the chest musculature and the front of the shoulders. You'll feel them stretch backwards. That's quite normal while you're getting used to it. And one further tip, often when we lift the chest, we can have an exaggeration of our lower back curve. So if you find yourself doing that and you're starting to overcurve from here, what you want to do is just squeeze your bum, squeeze your glutes, lock the hips off, and that'll just stop the spine from actually moving. You've locked your lower back off. So keep that glute tension on, and then you can lift the chest, counteract the head tilting back, lift the chest, straighten the middle back, and then we can squeeze. And again, no elevation. Okay, and I hope that helps. So soon we'll also talk about sort of introducing bands to actually use that motion in a few different ways and make it a little bit harder. Okay.